Good morning, everybody. So today we're going to talk about stiff necks. If you've never woken up with a stiff neck, I'm not entirely convinced that you're a human being. We've all pretty much been there, and that one bad morning can really stick around for some time. And the two most common things that cause a stiff neck are nerve issues and soft tissue issues. So we're going to start by trying to figure out which is which. When soft tissue is involved, like muscle, tendon, ligament, what we tend to expect is that your symptoms are usually worse when you lean away from the painful side, especially if you try to actively lift that side against loading, like lifting up or out, or if you push in towards that affected side, especially if you're starting to use some force. Nerves tend to react a little bit differently, bending towards the same side as a painful side, or if you extend your arm fully and then also extend your wrist at the same time, you may notice your symptoms get worse when we put tension on that nerve. If especially your arm's fully extended and you just experience an increase in symptoms with extension that goes away with flexion, you're probably expecting some nerve issues are causing it. So, not everyone fits these clean patterns, but if you do, we at least have an eye on where we're going. While nerve issues are usually relatively easy to address, I often still recommend going to someone who can really tease out some of the finer points of what we can do, because while a nerve can be pinched really easily, what's pinching it can vary, and we always want to make sure we know exactly what's going on before we start a treatment plan with things like nerves. So, physical therapists like myself, physicians, and chiropractors have some great techniques that can really get you moving on, and they can also perform a nice thorough exam to make sure that what they're doing is exactly the right thing at the time. So that's my usual recommendation if you're suspecting a nerve issue, because there's not usually one clear-cut answer. However, on the other hand, soft tissue issues are relatively easy, especially if your symptoms were caused by sleep positioning. Holding weight in your hands and forcefully shrugging up, sustaining that shrug for a couple seconds before relaxing can help reset, in a way of thinking at least, how those muscles are being guarded. So, doing a loaded shrug for about 5 to 10 seconds, doing 10 repetitions of that can actually help lengthen the muscle a little bit because it's working and resetting every time we actively turn it on and off. That can be extremely helpful for people who have a tightened up muscle and can actually help relax it over time. Of course, stretches are another common way to do that. If one side is painful, we gently stretch away from it by tilting our head that way, and you'll find that sometimes looking up or down will give us a little bit more of a gentle pull. Now when I say stretch, that is a key here. We want gentle pulling. You want to stretch just to the onset of a little bit of aggravation. You don't want to push hard into what's going on because that can actually make your muscles guard up even further. So, what we also find is that heat and anti-inflammatories can really help relax and control some of the irritation in that area. But the key here is to keep the unhappy tissue moving. While we want to make sure it's gentle, increasing the blood flow to the area can actually really help what's going on. Again, as always, it's tough to pin down what's going on sometimes, especially when there's more than one thing. So if you're just not sure what's going on, head to your local healthcare provider, and we're always happy to help and try and figure out a little bit more clearly what's going on and give you some things that can hopefully help move you along right away. Have a great day, guys.